Hello, my name is Dr. Jeffrey King. I'm a board-certified orthopedic hand surgeon, and I'd like to talk to you for just a few minutes today about the risks of orthopedic hand surgery. So if you're thinking about having an orthopedic hand surgery, that's a big decision, and it's certainly something that you should talk to your doctor about at length and make sure that all of your questions are answered. And one of the big questions after you've decided what the diagnosis is and what the appropriate surgical treatment are, in addition to understanding what the benefits of the surgery are, is what are the risks and what is the likelihood of those things happening. So for each surgery, these things are a little bit different, but I think a general overview of the risks of many of the surgeries that we do may be useful and informative. But again, I encourage you to talk to your surgeon specifically about the operation you're considering and the risks that he or she perceives for that procedure. With any operation, there's always a risk of infection. Anytime we break the skin, whether it's a small incision, a large incision, a blood draw, a flu shot, anytime we break the skin, there's always a risk of infection. In general, for most people, that risk is about 1%. There are places the risks are higher, places that have poor blood supply. Other considerations that increase your risk of infection are if you smoke, if you have diabetes, if you take steroids for any reason, or if you're on any chemotherapeutic drugs. Those things tend to impair your immune system a little bit and increase the risk of surgery. There's always a risk of bleeding. With any kind of incision, there's always going to be bleeding. And people at increased risk for bleeding problems, or what we call hematomas, are people who are on blood thinners. Now, generally, if you're on a daily baby aspirin for your heart, that's not a big deal, and we tend to let people continue to take that through their surgery. You can expect maybe a little bit more bruising, but you probably would have noticed that already in everyday life. So we usually let people continue to take their baby aspirin. If you're on Coumadin or Plavix or Eliquis or a number of these newer blood thinners, then generally your hand surgeon is going to recommend that you talk to the person who prescribed that medication to determine if that's something that you can simply stop a couple of days before the surgery, or if you need to be on that, there may be some special things that they need to do to make sure you're appropriately anticoagulated, which means your blood is appropriately thin for the surgery. But again, that's something that you need to talk to your doctor about, both your surgeon and the person who prescribed the medication. There's always a risk that you could have an injury from the surgery, that the surgeon could injure nerves or blood vessels or tendon, or that in some way something like that could happen. As a surgeon, I can tell you that's my top priority to make sure that doesn't happen. And we're very careful, and there are a number of steps we take, and obviously we've had a lot of training to minimize that chance, but there's always a small chance of something like that happening. There's the risk that you might not get better, you might not get the expected outcome. And again, that's something that's very specific to the individual surgeon, and you would want to talk to your surgeon about before you made the decision to proceed with surgery. There's the risk that you will have a painful scar. Most surgeries require incisions, and those incisions are going to tend to be tender after the surgery. So one of the things that your surgeon can talk to you about, or the therapist or the nurse or the PA can talk to you about, doing scar massage or rubbing the area after the stitches come out to try and make it less sensitive, and that can be very helpful. If you have a fracture, there's a risk that the fracture might not heal. Again, that's pretty uncommon. There are certain bones that have a harder time healing than others, like the scaphoid bone in your wrist, and there are other bones that heal pretty reliably, like your radius for a distal radius fracture. But the possibility of your fracture not healing is a small but real risk. There's a risk if you have a fracture and it's repaired that it could heal in the wrong position. Again, your surgeon's going to try very hard to make sure that thing heals in the right position. But ultimately, the goal of a surgery for a fracture is not to make you heal faster or to make you heal better. Your body is responsible for that. The goal of the surgery when the surgeon is fixing a fracture is to restore appropriate alignment and hold it in place while the fracture heals. Finally, there's a risk of anesthesia. And again, that's very individual. Some operations can be done with the patient's wide awake, requiring only local anesthesia, which has a very, very, very low risk of problems. Some surgeries require sedation, in which case you're breathing on your own, but you are given medication to make you sort of sleepy and forgetful. And then there are some surgeries that require more significant anesthesia. One of those things for hand surgeries is a block, which is where they would put medicine up here and make your entire arm numb. That's something to talk to the anesthesia person about. Or even general anesthesia, which is where we put a breathing tube, or the anesthesia person puts a breathing tube in so that you don't remember anything and don't feel anything. Generally, that's for bigger surgeries, but that's a question that you talk to your surgeon about and the anesthesiologist. So there are some risks associated with that, but presumably it's an operation that we can't do without making you anesthetized or sleepy or comfortable in some other way. So that's an overview of basic risks and benefits associated with hand surgery. Hopefully that's a helpful overview. I again strongly encourage you to talk to your doctor, your surgeon, the anesthesiologist, and try and get all of your questions answered to the best of your ability before you go down the road to surgery. We can't make any guarantees and we don't know for sure what's going to happen, but we can certainly share with you our best understanding of the risks so that you're fully informed at the time of your surgery. Hope that's helpful. Thanks very much.